Okay. Namaskar. I, Vishal Anand of BLLB 4th semester, cordially welcome you all in this webinar on role of Ayush in prevention and management of anemia. Whenever situations are not conducive around us, we often look for external help. But as Indians, we do not need to do the same. As Dayanand Saraswati said, let's go back to Vedas. We need to do the same, even when it comes to medicine. Anemia, most commonly known as iron deficiency disease, with a data estimation that more than 30% of world's population of women is anemic as per WHO. Now, the onus is on us as to how we can leave the originators of life and disease. The Ministry of Ayush is purposed with developing education, research, and propagation of indigenous alternative medicine systems in India. Ayush medicines are widely used as a standalone option or as adjunct with biomedicines in the long-term disease. Therefore, the relevance of Ayush has become more now because of this change in health paradigm. Now, with this, I call upon Dr. Budhendra Kumar Singh Sir, NSS Coordinator, Central University of South Bihar, to come and please share his thoughts and enlighten us with his words of wisdom. Sir, over to you.
Thank you, Vishal. First of all, I would like to thank Dr. Megha for accepting this warm request to come and share her thought on the prevention of anemia. With this particular theme that we are going to start today, we will continue this particular theme tomorrow to just spread the awareness among the slum area in Nepa and Daryapur village. Dr. Megha Sinha, who is a renowned gynecologist in Vardan Hospital. She is also founder director of Vardan Hospital. She has vast experience. She has worked in Ramanohar Lohia Hospital, and she has got many fellowships, very prestigious fellowships previously. And she is highly specialized in high risk pregnancy and critical care in obstetrics. Secondly, I also would like to thank Professor Atish Parasa, Dean Student Welfare, to join us with my request, and Dr. Vivek Narayana, who has joined us to share his thoughts. Now, starting with NSS, basically it's with a motto of not me but you. We have the responsibility of changing the society with small things that we can do for the society, and not for the benefit of us, only for the benefit of the society. We have to give something to the society. In this continuity, the Ministry of Ayush and Ministry of Youth and Cultural Affairs has asked us to give a webinar session in this particular topic, which is anemia and prevention of anemia in adolescent children. As we know that India, which is a country of such country where the slum areas and all these low-lying areas in a vast number, and if we don't think about them, basically, if we are saying about health, and our health is just a mirror image of the health of the society. So in order to change the overall perception of the healthy nation and a healthy society, we have to consider our health first. हमारा स्वास्थ्य हमारे जीवन का एक प्रतिबिंब है. अगर हम एक स्वस्थ समाज की स्थापना करना चाहते हैं तो एक पोषण आहार की बहुत ही आवश्यकता है, और हमारे जीवन में और जो हमारे लो लाइंग एरियाज, जो हमारे आसपास के एरिया हैं जिनमें इस तरह की अवेयरनेस की कमी है, उसमें वो अवेयरनेस फैलाने की जो जिम्मेदारी हमारे एनएसएस यूनिट के द्वारा चलाई जा रही है वो काबिले तारीफ है, और हम इस और भी अपना कदम बढ़ाते रहेंगे और सोसाइटी को एक नए आयाम तक लाएंगे जहां पे उनमें ये अवेयरनेस रहे कि एक स्वस्थ समाज के निर्माण के लिए हमें क्या क्या करने की आवश्यकता है. जैसे कि आयुष मंत्रालय और जो हमारी मिनिस्ट्री है, इन्होंने बताया है कि हमारे पास जो पोषण है, पोषण के 5 बेसिक सूत्र हैं और उन सूत्रों में हमारा साफ सफाई, सैनिटेशन और पौष्टिक आहार और प्रिवेंशन फ्रॉम डायरिया, प्रिवेंशन फ्रॉम एनीमिया एंड स्पेसिफिकली द गर्ल एडोलेसेंट चिल्ड्रन में एनीमिया, जो आयरन डिफिशियंसी और पोषण की कमी, इन सबको अवॉइड करना, ये हमारे पास सबसे बड़ी रेस्पॉन्सिबिलिटी है और टास्क है और इसके बारे में अवेयरनेस फैलाने की जरूरत है। एनएसएस यूनिट 7th वर्ल्ड हेल्थ डे के उपलक्ष्य में एक रैली निकालने जा रहा है। मैं आग्रह करूंगा विवेक नारायण सर को और मेघा मैम को कि अगर पॉसिबल हो सके तो वो मॉर्निंग के सेशन में इस रैली में शामिल हो, जो 8 बजे यूनिवर्सिटी से निकलकर धर्मशाला और नेपा गांव में जाएगा, जहां पे एक नुक्कड़ नाटक का आयोजन किया जाएगा, जिससे एनीमिया और उसके प्रिवेंशन से रिलेटेड चीजों को दर्शाते हुए हम उनमें एक अवेयरनेस फैलाने की कोशिश करेंगे। With this, I'm not expert of this medical things. So with this, I request Professor Atish Parasar, who is Dean Student Welfare of Central University of South Bihar, to give a welcome address. Professor Atish sir. Atish sir.
I hope I am audible now.
Yes sir. Yes sir.
Thank you so much, Coordinator NSSC Unit CUSB, Dr. Budhen Singh, for inviting me to deliver a special welcome address. And I am very happy to welcoming a seasoned medical practitioner, Megha ji, here at CUSB. Although it is virtual, but obviously I think we all will be benefited by your experience, by your expertise, and I hope that the session, which is being organized by NSS unit, would achieve the target. And first of all, I would like to welcome you, Dr. Megha, and obviously the topic is typically related to medical field. So all of us, despite being called doctor, cannot speak over this topic, and obviously we would have a great listening session. Today, I would also like to welcome our most beloved Dr. Vivek Narayana here in this session, and I hope with two medical experts, we will be having a very good session, and we will be having a very great, deep understanding, deep insight over this issue, which is being introduced by our coordinator. I would also like to welcome in this session Honorable Vice Chancellor CUSB. His inspiration, his presence, and his directions has always given a strength and energy to all of us, and so that we could organize various activities, various programs inside the campus within a very short span of time. And as Budhenji informed us that this is not just a session online, but here we will develop an insight, and tomorrow that insight will be transferred to the villages near around. Obviously, I think this may be one of the unique and most important CSR done by any institution. So I congratulate entire NSS team and NSS unit and the students for working in a action mode and translating the real motto of NSS, which was being introduced by coordinator, not me, but you. So thank you so much all. for joining this session. And I won't take much time. Rather, I would love to listen our lovely panel. Thank you so much.
Thank you so much,
Vishal is
sir.
not audible.
And thank you so much, Burain sir, also. Level. Now, ma'am?
You're audible now.
Okay. So thank you so much, sir. Thank you, DSW, sir. Thank you, Burain, sir. As Burain, sir, rightly mentioned, that change should be there at the ground level. And that is very true. And as our Honorable DSW, sir, mentioned, that Vivek, sir, is the most lovable doctor in this whole CUSB campus. He is always there, standing firm in times of crisis. Thank you so much, sir. So without taking much time, it's time for us to listen to the insights by our key speaker, Dr. Vivek Narayana. He is a medical officer in the CUSB, he is an MBBS, and also holds a postgraduate diploma in diabetics management. Also, he is a very active member of IBSC Ethics Committee, and he has previously worked as a resident doctor in Max Hospital, Delhi, and at the Indian Spinal Injury Center. Sir, over to you.
Okay. Thank you, Vishal. First of all, very good evening to Dr. Buddhendra sir, Renu madam, Atish sir, and our guest speaker, and who is a gynecologist and obstetrician, one of the leading practitioner, as sir has told. So welcome you, ma'am. And so before we, go to the main topic, actually, what anemia is, from where the origin of anemia came. Actually, anemia is a word which has been derived from Greek word that is anemia, means lack of blood. So the anemia is all about lack of blood. So what is blood actually? So blood contains many components. The main component being is plasma, RBC, WBC, and platelets. But as far as anemia is concerned, the main component what we will be dealing with is RBC. RBC contains hemoglobin, which is actually RBC contains hemoglobin, which is made up of one of the main component of hemoglobin is actually iron. So before we go to the anemia, we will have to know the normal, because in anemia there is lack of blood or lack of hemoglobin or low level of hemoglobin. So before we go to the what actually is the lower, before we go to the lower limit, we will have to know what actually is the normal limit of hemoglobin in our body. So in our body, because we are, male and female both are having different level of hemoglobin. So in male, the normal hemoglobin ranges between 13.3 to 16.3. That is, we can roughly say 13 to 16. And in female, it ranges between 12 to 15.8, or we can say 12 to 15.5, or near about 15.9 or 15.8. So any decrement or any, lower in the level of hemoglobin from the lower level, that is, if it is below 13.3 in male or 12.0 in female, then we can say that that particular person is suffering from anemia. So anemia per se, actually there are many types of anemia. but today we are focusing mainly on iron deficiency anemia, because we have to discuss mainly on the adolescent age group, childbearing age group, what Megha ma'am will be dealing with. So uh, the I mean, as we talk about anemia, so there must be some sign and symptom. So sign and symptom. Sign is the thing what doctor noticed, and symptom what patient presents with. So first and foremost symptom patient will present with. Suppose I am having anemia or low hemoglobin level or low blood level in layman language, then there will be my colleague or my relative or anybody can say that my skin color is pale. I mean, the normal color of the skin is not maintained, although it is, I mean, mostly visible in the people who is fair colored. So first one is pale color, what I am dealing with the symptom. Second symptom, I mean, what patient presents with. Second symptom may be irritability. The patient may complain of that, you know, the relative of the patient may complain of that Mr. So and so is quite irritable, what he was not before. So we will have to think that whether this guy is having low hemoglobin level or what. Third one is weakness or tiredness. I mean, after covering short distance, or we can say there is two things. One is acclimatized, or one is another one is unacclimatized. So while doing acclimatized thing also, the such and such patient will or person will complain of that I used to feel, tiredness, or I used to get tired. So then we'll have to think that whether the hemoglobin level is low or what. Third one is breathlessness, because the main function of the hemoglobin is to carry oxygen in the different part of the body. So suppose hemoglobin is low, then obviously circulation of oxygen will be also on the lower side. So to recover or to cope up with that, oxygen demand, body will be, or our lung will be breathing much with a faster rate. So there will be breathlessness. Then one more symptom patient may present with, that is glossitis. Glossitis is what? There is a redness of tongue or oral mucosa. Particularly glossitis word is used for mainly for tongue. Then related to the oral cavity, patient may present with, there might be some infection over the angle of the mouth. So here they will come with the complaint of that recurrent some infection or some wound like thing will be there. So then also then again we will have to think that whether that person is having low hemoglobin or what. Then one more important thing is that see, our nail is this, so nail is having more sort of convexity. See, this is having convexity with the indrawing of the side of the nail or margin of the. But in iron deficiency anemia, there will be spooning of nail. So the part what is convex may get concavity. Okay, so it may get dimple like thing, and margin will get elevated. So that is called as spooning of nail. One very important symptom what patient comes with, this, that is restless leg syndrome, RLS. Actually, while during night time when patient goes to bed or for the sleep, then actually generally patient will not complain of, but their relative or their partner, whether husband or wife, anyone, they will complain that to the doctor that during night time that such she used to throw legs like anything, or he used to throw legs like anything. That is restless leg syndrome. Very important finding of iron deficiency anemia. Then these are the sign and symptoms. Then causes, what all cause iron deficiency anemia. First and foremost, or you can say leading causes, one of the leading causes of iron deficiency anemia is hookworm infestation. That is worm infestation. The particular name of that hookworm is ancylostoma. So actually hookworm gets attached to the small intestine of our body. So at the part where, I mean, it is getting attached with that particular part of the small intestine, there will be oozing of blood from that side. So actually, it's a chronic thing. Sorry, it's a chronic thing, and many a little makes a mickle. So gradually there will be loss of hemoglobin. So ultimately, the patient will land up in iron deficiency anemia or anemia. Then very important in case of adolescent age group, uh, that is called first menstruation is called as menarche. So at the time of menarche, because cycle becomes very irregular and there will be profuse bleeding. So that is one of the leading causes of anemia in adolescent child group, that is menses. So heavy flow, wherever heavy flow is there, then chances of getting them anemic is more likely. Then another one is gastrointestinal bleeding, and one is peptic ulcer bleeding. So whenever, actually this is mainly habit induced. So suppose you are fond of some spicy food, or you are, I mean, suppose some like simple like body ache is there, then you used to have NSAID, that is diclofenac group of medicine, any painkiller that can cause peptic ulcer, I mean ulceration of the gastric mucosa, stomach mucosa. So chances of bleeding from that particular mucosa is also there, and that can cause gastric, anemia. Then any cancer, because cancer is, I mean, famous for, suppose you are giving a gentle tap also, then cancerous cell or tumor cell used to bleed like anything. So any cancer, there will be anemia. One very important causes of anemia is pulmonary cox, that is pulmonary tuberculosis, TB. Patient will complain, I mean, patient used to have sputum, that is productive sputum with blood in the sputum. So it, since it's a chronic process, so if suppose patient is not able to explain to the doctor and he is having persistent blood mixed sputum, then chances of landing up in anemia or low hemoglobin, that is iron deficiency anemia, is more likely. Of course, diet. Actually, basically, wherever there is any loss, then three things are responsible. Either you are not having proper diet, either the second one is either your that particular element, that is iron, is not getting absorbed in a proper fashion, and third one is either whether that particular iron is getting, I mean, lost like anything from any part of the body. So three things. So one very important causes of anemia, that is iron deficiency anemia, is diet. If you are not having proper diet, particularly in female, because female used to have menstruation, and because childbearing age group, so and she is not having proper diet, then chances of landing up in hemoglobin deficiency is more likely. Ultimately, that is called as iron deficiency anemia. Then one disease that is called a celiac disease. So wherever they, because iron gets absorbed in the small intestine, that is duodenum, and small part of the small intestine, that is duodenum. So suppose there is some mucosa, I mean inner part of the intestine, that is the, you can lemon, you can say that some inner muscle layer. Actually, no, it's not a muscle, it is called a mucosa. So suppose there is some transformation over there, then the absorption gets hampered, absorption of iron gets hampered. So low iron will be there in our body, and ultimately there will be iron deficiency anemia. Then of course low birth weight, the, because madam would be explaining about the, I mean, the mode of low birth weight, what are the causes of low birth weight and complication of low birth weight. So just I am superficially explaining. Low birth weight is also one of the causes of iron deficiency anemia. In, and one very important thing is there, infants who consume more than 700 ml of milk per day after 6 months of age. Actually, generally we start weaning food, we start to give our kids after 6 months, because breastfeeding is exclusively advisable for 6 months. So after 6 months, we are supposed to give some weaning food like suji ka halwa, khichdi, etc. So suppose if you have started giving your kids with more amount of cow milk, then chances of also having iron deficiency anemia is more likely. And one more important thing is there, that the kid who is overweight, that is also one of the causes of iron deficiency anemia. Then okay, then we will come to the diagnosis of the how to diagnose the iron deficiency anemia. Actually, one what I told, that symptom, sign and symptom, after seeing the sign and symptom, you can think of whether this guy is having iron deficiency anemia or what. And another one is complete blood count, that is CBC, hemoglobin, MCV, MCHC, and MCH. These are the some blood parameters which can give you the clue about iron deficiency anemia. And last one is treatment. So treatment is mainly, I mean, what I told, if you are not having proper diet, then that is iron rich diet, then chances of having iron deficiency is more likely. So if we will have to take, or you will have to take, anybody will have to take proper iron rich food. So the food supplement, which nowadays government has, government has ordered many manufacturers to, that is called as like oil, mustard oil is mixed with, or with iron. Flour is mixed with, like Asirwad atta is mixed with iron. So that is called a food fortification. So that is one important source of iron. Then another one, another vegetables like any green leafy vegetable is having, ample amount of iron, like spinach or beetroot, any green vegetable, whether it's pumpkin, but spinach is one of the richest sources of iron. Good, that is jaggery. Jaggery is one of the sources of iron. Then dates, khajur, jisko bolte. Khajur is one of the richest sources of iron. Uh, I think any green leafy and these are the some important dietary product which is responsible for the increased amount of iron in our body. And of course, so one more important thing is there, the person who, due to some, I mean, any issue, he has developed some kidney disease. So because kidney, one erythropoietin hormone is there, which is responsible for the erythropoiesis. And what is erythropoiesis? The formation of hemoglobin or RBC, that is blood formation, that is called a erythropoiesis. So suppose the person, anyone who has developed or landed up in kidney disease, then chances of having low hemoglobin or low iron is more likely. So they will have to be given with extra outsourced erythropoietin injection is available in the market. So the last one is medicine product. So iron, generally ferrous tablet, or many products are there available in the market. Injectable form is also there. So I think this completes the, I mean, iron deficiency anemia in brief. And I'll request Megha ma'am to focus mainly on adolescent age group, iron deficiency anemia in adolescent age group and childbearing age group, complication and management of the same. Thank you, ma'am. Thank you, sir.
Good evening, everybody. Am I audible?
Ma'am, let me welcome.
Okay. Ma'am, you are audible, but I would just request you 2 minutes so that you can be formally introduced.
So,
Megha ma'am? Yeah, Vishal, please take over.
yes, ma'am. Thank you, ma'am. As a disease which is present in almost around 400 forms, it is really difficult to identify the origin, symptoms, and causes. But Dr. Vivek literally took us from origin of anemia, then take us to the symptoms in a very lucid manner, and then identify the cause who are very well present in the environment. So that was really insightful, sir. Thank you so much for that. Now, the time has come for us to listen to the valuable insights from of our guest speaker, Dr. Megha Singh, who is MBBS, MS, specialization in gynecology from Safdarjung Hospital, New Delhi. She is a ex-senior resident, Ram Manohar Lohia Hospital, New Delhi. She has a fellowship in minimal access surgery, fellowship in assisted reproductive technology, fellowship in cosmetic gynecology. She is also the founder and director of Consultant Obstetrician and Gynecologist in Vardan Hospital and Maternity Center, Gaya. She has a special interest in high risk pregnancy and critical care in obstetrics. Ma'am, the floor is yours. Please guide us with your valuable insights.
Thank you. Good evening, everybody. Many thanks to all the organizers of this beautiful panel discussion on anemia and prevention. I think Dr. Vivek sir has beautifully explained. He has totally covered all the points. And I will just throw a little more light on the management of anemia, signs and symptoms in adolescent and women of childbearing health, of childbearing group. सो आई थिंक आज सर ने आप सबको बताया है कि आयरन की कमी किससे होती है, मतलब अनीमिया का जो मोस्ट कॉमन कॉज है, सर ने बताया आपको कि सबसे जो इम्पोर्टेंट कॉज है अनीमिया का वो है आयरन डेफिशिएंसी, उसके बाद हुकवर्म इन्फेस्टेशन होता है. तो आयरन जो डेफिशिएंसी है अनीमिया, ये एडोलसेंट गर्ल्स में और वीमेन में इंडिया में ज्यादा है. मेन में क्यों नहीं होता, उसके पीछे एक बहुत बड़ा रीजन है. देयर इज अ बिग रीजन व्हाई women have anemia more common than men is because there is a physiological thing called menses. जैसे सर ने बताया, there is periods. All women of childbearing age group from 12 years to 55 years, they are prone to anemia because every month every woman is losing around 80 ml to 100 ml of blood. ठीक है, तो उसमें क्या होता है, हम इन इंडियन सोसाइटी लॉट ऑफ विमेन, लॉट ऑफ इंडियन गर्ल्स, दे आर नॉट एबल टू, दे हेजिटेट अ लॉट, दे आर नॉट एबल टू कम अप विद इट, दे आर नॉट एबल टू टेल देयर पेरेंट्स और देयर फैमिली मेंबर्स इफ दे आर हैविंग अ लॉट ऑफ ब्लीडिंग प्रॉब्लम. So the thing is we have to identify those who are at risk, those who are having problems, those who are having severe anemia, and we have to correct them at the right time because anemia जितना simple लगता है उतना ही it is very dangerous to the life of a mother or in general it decreases the quality of life of every woman. So why I'll be focusing more on the adolescent group, which is from 12 years to 19 years, and then the childbearing group, which is from 19 years to around 30-35 years of life. So every month जो periods होता है, every woman has to lose around 80 ml to 100 ml of blood. Heavy bleeding किसको बोलते हैं? Why we are more prone to anemia is because people don't realize कब when to seek a medical help, when to seek that कि मुझे heavy bleeding हो रही है, now I should go to a gynecologist, मुझे anemia develop हो रहा है. जैसे सर ने बताया, सर has told that the girl, जो भी childbearing age की जो women होंगी या जो girl होंगी, उनको sign symptoms आने लगेंगे. They'll have symptoms like generalized weakness, fatigue. If you see them, they will appear pale. If you see their tongue or their eyes, their nails, they will appear pale. They will complain of generalized weakness. They'll complain of palpitation. बोलेंगी मुझे धड़कन लग रही है, मुझे लगता है कि दिल जो जोर से धड़क रहा है, तो उसको palpitations बोलते हैं. या फिर उनके चेहरे पे swelling होने लगेगी, पैरों पे swelling होने, they will develop pedal edema, उसको पैर में swelling बोलते हैं, या चेहरे पे swelling होने लगेगी. तो ये सब चीज है. Heavy bleeding कब बोलते हैं? When normally any woman should have bleeding which can be any day from 2 days to 5 days every month. If you are changing more than 7 to 8 pads in a day, or you are changing more than 1 pad per hour, and or या फिर your menses are increasing to more than 5 days in a month, that is called heavy menses. उसमें क्या होगा, नॉर्मली फिजियोलॉजिकल अगर आप 80 ml ही ब्लड लूज कर रहे हैं तो आपको एनीमिया नहीं होगा, बिकॉज दैट इज अ नेचुरल प्रोसेस एंड एवरी मंथ यू हैव टू लूज ब्लड. बट इफ यू आर चेंजिंग मोर देन 1 पैड पर डे, और इन द एंटायर डे यू आर चेंजिंग मोर देन 8 to 10 पैड्स, और you are bleeding for more than 5 days in a month, और आपको instead of 30 days if you are getting a cycles every 15 days or 20 days, or you're passing big clots in the menses, so that is a sign that आपको menses bleeding heavy हो रही है, and you should meet your gynecologist. जो आपको basic test anemia के लिए, जैसे सर ने बताया, आपको CBC करवाएंगी, आरबीसी का साइज देखेंगे, प्लेटलेट्स देखेंगे, वो सब आपको चेक करेंगी, और लगेगा कि नहीं अनीमिया है तो वो आपको अकॉर्डिंगली मेडिसिन बताएंगी. जो हमारी गवर्नमेंट भी जो है, जो गवर्नमेंट ऑफ इंडिया है, since we know that all most 70% of the or in 80% of the Indian women are anemic. जो आइडियल ब्लड होना चाहिए, जो हेमोग्लोबिन होना चाहिए, इंडियन फीमेल शुड बी मोर देन 12 ग्राम्स पर 100 ml. बट आप जो हमारे पेशेंट्स ओपीडी में जो पेशेंट्स आती हैं, स्पेशली दोज फ्रॉम विलेजेस, दोज हु आर अनअवेयर, दोज हु डू नॉट टेक आयरन सप्लीमेंट्स ड्यूरिंग प्रेगनेंसी, इनका एनीमिया हेमोग्लोबिन बहुत कम होता है. समटाइम्स ज्यादातर लोगों का 8-9 ग्राम के आसपास होगा, या जो बहुत ही सीरियस होती हैं, बिल्कुल पेल होती है, उनका हेमोग्लोबिन 3-4 ग्राम भी होता है, जो कि विच इज वेरी डेंजरस फॉर द लाइफ ऑफ अ मदर. तो जो गवर्नमेंट ऑफ इंडिया है वो भी जितनी भी प्रेग्नेंट पेशेंट्स हैं उनको हम लोग जो है वी रेकमेंड 100 milligrams of iron every day. That is the recommended dietary allowance of every woman. It should be 100 milligrams per day for 100 days. ये प्रेगनेंसी में. नॉर्मल, अगर जो नॉर्मल जो लड़कियां हैं डॉल्सन ग्रुप में, इफ देयर फूड इनटेक इज गुड, जो जैसे मैंने बताया, जैसे सर ने बताया कि आपकी अगर डाइट अच्छी है, अगर आप आयरन रिच फूड खा रहे हैं, जैसे कि पालक हो गया, जैसे कि डेट्स हो गया, जैसे कि गुड़ हो गया, सर ने बताया आपको, या फिर चना, गुड़ एंड चना इज सपोज टू बी अ वेरी गुड सोर्स ऑफ आयरन. एप्पल हो गया, बनाना हो गया, ड्राई फ्रूट्स हो गया, अगर आप ये सब खा रहे हैं तो यू डोंट नीड अ सप्लीमेंट. बट इसी कारण से अगर आपको ब्लीडिंग ज्यादा होती है, मेंसेस ज्यादा होता है, या आपको हुक इन्फेस्टेशन है, पेट में जोंक जिसको बोलते हैं, पेट में कीड़ा है, तो उसके लिए अलग से आयरन का सप्लीमेंट मिलता है. बहुत सारे ब्रांड्स हैं अच्छे मार्केट में, और आपको आयरन की गोली लेनी चाहिए सप्लीमेंट. जब आप प्रेगनेंसी में पहुंचते हैं तो आपका रिक्वायरमेंट एक नॉर्मल वुमन से ज्यादा होता है, बिकॉज आपके साथ साथ आपका एक बच्चा भी डेवलप हो रहा है, जो कि 9 months के बाद एक 2.5-3 किलो का बच्चे को आप जन्म देंगे, तो बच्चे की भी रिक्वायरमेंट होती है, बच्चे के भी टिश्यूज को डेवलप करना है, बच्चे में भी ब्लड जाता है. तो आयरन का रिक्वायरमेंट प्रेगनेंसी और लैक्टेटिंग विमेन, डिलीवरी के बाद भी आपको आयरन चाहिए, बिकॉज आपको दूध पिलाना होता है. तो जो हम लोग प्रेगनेंसी और लैक्टेशन में आयरन का जो सप्लीमेंट है हर फीमेल को, चाहे आपका हीमोग्लोबिन 11 ग्राम भी हो तो भी, 12 ग्राम भी तो भी हम लोग देते हैं. एक सेकेंड. तो वो मैं कह रही थी कि आपको देना है. दूसरी बात है कि डर, रिस्क किस चीज का होता है. जब एक एडोलसेंट फीमेल जिसका एनीमिया है और वो प्रेग्नेंट होती है, तो उसको लाइफ में बहुत सारी रिस्क होती हैं. एक तो अगर आपका हीमोग्लोबिन कम है तो बच्चे का वेट भी नहीं कम होता है, बच्चे को लो बर्थ वेट, जैसे IUGR बोलते हैं, इंट्रा यूट्राइन ग्रोथ रिटार्डेशन, बेबी का वेट 2.5 किलो. डिलीवरी के दौरान पेशेंट्स होते हैं, जैसे कि ब्लीडिंग हैवी होना, डिलीवरी के दौरान काफी ब्लीडिंग जाना, डिलीवरी के बाद ब्लीडिंग को नहीं रुकना, यूट्रस को कॉन्ट्रैक्ट नहीं होना. आजकल तो आप लोग टीवी न्यूज में देख रहे हैं कि पोस्टपार्टम हैमरेज है. आजकल हर जगह न्यूज में चल रहा है कि पोस्टपार्टम हैमरेज हुआ, राजस्थान में पेशेंट की प्रसूता की मौत हो गई. तो ये सब चीजें होती है. दिस आर कॉम्प्लिकेशंस ऑफ एनीमिया. अगर आपका हीमोग्लोबिन अच्छा है, अगर 11 ग्राम है, 12 ग्राम, उसके बाद भी अगर आपको पोस्टपार्टम हैमरेज होता है, तो यू आर स्टिल सेफ, बिकॉज यू हैव इनफ रिजर्व इन योर बॉडी. बट आपका एनीमिया पहले से ही अगर आपको कम है, आपको 5 ग्राम 6 ग्राम है, आपको ब्रेथलेसनेस हो रही है, तो देयर इज लॉट ऑफ रिस्क टू द लाइफ ऑफ मदर. देयर इज लॉट ऑफ रिस्क ऑफ गोइंग इनटू फेलियर ऑफ, बिकॉज एनीमिया के चलते जो प्रेग्नेंट पेशेंट होती हैं एट द टाइम ऑफ लेबर, देयर इज अ लॉट ऑफ लोड इन द हार्ट. The heart has to pump really hard. There's a lot of pressure overload, volume overload. The heart has to pump really hard to supply enough blood to the entire body. तो कम हीमोग्लोबिन है, कम ये आपका ब्लड कम है, तो पेशेंट का हार्ट फेलियर होने का चांसेस एट द टाइम ऑफ लेबर इज वेरी हाई. तो इट इज इम्पोर्टेंट कि द एंटायर आपकी 9 months जो है, इट शुड बी सुपरवाइज्ड अंडर अ गायनेकोलॉजिस्ट. टाइम टू टाइम एवरी 3 months हम लोग हेमोग्लोबिन चेक कराते हैं, एंड सप्लीमेंट जो है हम लोग पेशेंट्स को देते हैं. डिलीवरी के बाद भी मैनेजमेंट अच्छा होना चाहिए. अगर PPH होती है, ब्लीडिंग होती है, तो इट हैज टू बी प्रॉम्प्टली मैनेज. Now coming to supplements, like most of the iron supplements that we have in the market, they are in the form of iron ascorbate. बहुत सारे केमिकल सॉल्ट्स होते हैं आयरन के जो हम लोग देते हैं. तो सबसे इंपॉर्टेंट चीज ये भी है कि बोलना बहुत आसान है, बट मोस्ट ऑफ द आयरन सप्लीमेंट्स दैट वी रेकमेंड टू पेशेंट्स, समटाइम्स वो टॉलरेट नहीं हो पाता. पेशेंट को पेट में दर्द होता है, पेशेंट को गैस होता है, लैट्रिन भी काला होता है. तो इफ यू वांट टू चेक वेदर द पेशेंट इज रियली ईटिंग, ये एडोलसेंट फीमेल को हमने दिया या किसी को दिया, तो इज शी रियली कंप्लायंट विद द ट्रीटमेंट और नॉट. यू आस्क इफ शी इज पासिंग डार्क स्टूल्स. जो डार्क कलर्ड स्टूल्स होते हैं, अगर वो आयरन खा रही होगी तो पेशेंट को लैट्रिन काला होगा. आपको अपने बच्चों को या जो भी आपके फीमेल आपकी जो आयरन की सप्लीमेंट खा रही है, उनको आपको काउंसिल करना है कि लैट्रिन काला हो सकता है, पेट में दर्द हो सकता है, गैस हो सकता है. और आयरन अगर नहीं टॉलरेट हो पाता है, ओरल आयरन जो टैबलेट्स मार्केट में है, तो आयरन इंजेक्शंस भी होते हैं, आयरन सुक्रोज के इंजेक्शंस भी होते हैं, जो कि आप सीधे पेशेंट को IV लगवा सकते हैं इंट्रावीनस. और 3 to 4 वीक्स में, चाहे आप ओरल आयरन खाएं, चाहे आपने आयरन का इंजेक्शन लिया है, इट टेक्स अराउंड 3 to 4 weeks टू ब्रिंग द आयरन लेवल्स टू नॉर्मल। मतलब 3 वीक में 1 to 2 ग्राम्स का आयरन का लेवल, हेमोग्लोबिन का लेवल जो होता है आपके बॉडी में इंक्रीज करता है। और जो सिंस वी आर टॉकिंग अबाउट आयरन डेफिशिएंसी एनीमिया, सो आई विल नॉट कम टू ब्लड ट्रांसफ्यूजन, बट अगर आपका इफ यू हैव एनी काइंड ऑफ जीआई प्रॉब्लम, जीआई इंटॉलरेंस है, सीलियाक डिजीज एज सर हैज मेंशन्ड, देयर लॉट ऑफ डिजीज ऑफ क्रॉनिक एनीमिया, जैसे किडनी डिजीज जिसमें एरिथ्रोपोइटिन नहीं बन पा रहा, अनीमिया सिंथेसाइज या थैलेसीमियाज है, कंजेनाइटल हेरिडिटरी एनीमियाज है, उन केसेस में ओरल आयरन भी बहुत बार काम नहीं करता, तो उन केसेस में कई बार ब्लड ट्रांसफ्यूजन भी करना पड़ता है। तो आई थिंक अगर डिवर्मिंग, अगर आपको लग रहा है कि वर्म है, पेट में कीड़ा है, उसके कारण हुकवर्म इन्फेस्टेशन, उसके कारण भी अगर आपको एनीमिया है, तो हम लोग सिंपल सी गोली देते हैं। एल्बेंडाजोल का एक गोली होता है 400 मिलीग्राम्स का, वो हम लोग एडोलसेंट गर्ल्स में मास स्केल पे, हम लोग स्कूल्स में, कॉलेजेस में हम लोग मास स्केल पे डिवर्मिंग करते हैं। दैट इज ऑल्सो वेरी यूजफुल। I think anything else I'm missing on? If you want to, I can talk on that.
I don't think so, ma'am. ये sufficient था.
Yeah, because I understand there are a lot of people who are non-medical, so I think this is the best that I can explain to them.
जी, ma'am. Thank you.
Thank you.
विवेक सर, कुछ क्वेश्चंस हैं वो मैसेज में, तो थोड़ा मैम को कहिए वो देख करके उसको आंसर कर देंगे। मैसेज में कुछ क्वेश्चंस पुट किया गया है, वो थोड़ा सा देख लीजिए।
Yes, I think, ma'am, as you said that am I audible clearly?
Yes,
Vishal, am I
You are audible.
Okay.
Yes, sir, you are audible.
So,
Just give...
first of all, we all should thank Megha ma'am for giving so good health information to all of us. And now I will read some questions, ma'am, and
Yes.
sir also, to Vivek sir. I think you both are from little different expertise on anemia issue. So the first question is from Sumant Kumar, and he want to know that can there be an ideal diet to stay safe from anemia in hectic university schedule, where normally our degree span from 4 to 5 years. So this is a very practical question, ma'am, that 4 to 5 years they live in this university for a degree. So what they can do to stay safe, ma'am?
See, there is an ideal diet, लेकिन हम लोग we Indians we don't eat proper diets. हम लोग की शेड्यूल बहुत erratic है, ब्रेकफास्ट नहीं करते, लंच करते एक टाइम, डिनर भी हम लोगों को जो मन करता है। तो द थिंग इज देयर इज अ recommended dietary allowances of all the micronutrients and important ingredients. कार्बोहाइड्रेट्स कितना लेना है, प्रोटीन्स कितना लेना, आयरन का जो RDA है इट इज अराउंड 100 मिलीग्राम्स पर डे। तो वैसे तो आयरन रिसोर्स सर ने आपको अच्छे से बताया कि ड्राई फ्रूट्स है, बट जो सस्ती चीजें हैं जैसे कि आपका पालक हो गया, गुड़ हो गया, जैगरी, चना हो गया, स्प्राउट्स हो गया, दीज आर वेरी गुड सोर्सेज ऑफ आयरन। केला हो गया, एप्पल हो गया, ये सब आप खा सकते हैं अगर आपकी डाइट अच्छी है। तो आई डोंट थिंक यू नीड सप्लीमेंट्स। एंड साथ में एक और इम्पोर्टेंट चीज है कि अगर आप आयरन टैबलेट्स अगर आप ले रहे हैं, साथ में अगर आपको एब्जॉर्प्शन अच्छा करना है तो आयरन के साथ कभी कैल्शियम नहीं लेते, आयरन को दूध के साथ नहीं लेते, आयरन के साथ आप विटामिन सी का टैबलेट लीजिए। विटामिन सी का रोल तो आप लोगों को पता है, इट इज एन इम्यूनो बूस्टर। इतने सारे लोगों ने कोविड में विटामिन सी का डोजेस लिया। इफ यू टेक आयरन टैबलेट विद विटामिन सी, it increases the absorption and it increases the hemoglobin level in a much better way. So there is an ideal diet, but I doubt how many of us will be able to follow. But if you include certain food habits जो हम कहते हैं green leafy vegetable जितनी भी हैं, उन सब में अगर आप खाते हैं तो you have enough of iron, and I don't think you will need any extra supplements.
Okay, thank you, ma'am. I think Sumant, you have got answer of your question. Now the second one, it is from the same person. Vivek sir, आप जरा इसका explanation दें. He is asking, is there any relationship between mental and physical health which results in anemia?
नॉट, मेरे ख्याल में डायरेक्ट तो कोई रिलेशन नहीं है, बट इनडायरेक्टली रिलेशन होगा, बिकॉज वेयर एवर देयर इज मेंटल हेल्थ बहुत बड़ी टॉपिक है। जैसे नर्सिंग सर आप तो इस फील्ड के हैं, तो अब इसमें मान ले कि कोई डिप्रेस्ड है, कोई साइकोलॉजिकल उसको एबरेशन है, तो ऑब्वियसली वो न तो उसको खाने का कुछ रहेगा, आई मीन न टाइमिंग रहेगा, न प्रॉपर जो रिकमेंडेड डेली अलाउंस है न तो वो रहेगा, न ड्राइव कब खाना है। सो उसके कारण हो सकता है। अदरवाइज डायरेक्ट कोई ऐसा तो मैम क्या डायरेक्ट तो मेरे ख्याल में कोई ऐसा लिंक नहीं है कि जिससे आई मीन कनेक्शन कुछ नहीं है।
नहीं हाँ डायरेक्ट।
जी। Okay, thank you, sir. And now one last question we can take, that is from Khagesh Singh, and he's asking about how deadly can this disease be? ये डिजीज कितनी डेडली हो सकती है?
आई थिंक सर मैम ने बहुत अच्छे से एक्सप्लेन किया, बिकॉज वन ऑफ द लीडिंग कॉजेज में से है ये मैटरनल मोर्टेलिटी रेट का, मतलब जो प्रसूता होती हैं उनका डेथ को वन ऑफ द लीडिंग कॉजेज में से है। खास करके जब आपका लाइक डिलीवरी के समय अगर आपकी ब्लीडिंग हो गई, आई मीन पोस्टपार्टल हेमरेज उसको बोलते हैं, या एंटीपार्टल हेमरेज या पेरीपार्टल, कुछ मतलब डिलीवरी से पहले, डिलीवरी के समय या डिलीवरी के बाद अगर और आपने अगर प्रॉपर मेंटेन नहीं किया है आयरन का लेवल, तो फिर आई मीन हीमोग्लोबिन का लेवल अल्टीमेटली, बिकॉज हम लोग आयरन और हीमोग्लोबिन को बात कर रहे हैं, तो बिकॉज वेर एवर आयरन लो होगा तो हीमोग्लोबिन लो होगा, मतलब ब्लड की कमी होगी। तो इसलिए ये डेडली तो है, ये बहुत सारे जगह में देखा गया है कि वो लाइफ थ्रेटनिंग हो सकती है ये।
Thank you, sir, and thank you, ma'am, for answering our queries. And I think now it is on our part to act. But we have heard information, so I think we promise you all that we will act on it. Thank you so much.
Thank you, sir.
Thank you.
Renu ma'am, over to you.
What's in a name? But I say that something in a question, and that was a really good question and answer session. Thank you, Dr. Nursing sir, for moderating the session. Now, this event would not have been possible without the tip and toe effort of our professor, Miss Renu. So I request ma'am to propose the vote of thanks.
Thank you so much, Vishal. I'm audible. I hope I'm audible to everyone.
Yes.
Thank you. Thank you so much, Vishal. I, Renu, as a member secretary in the NSS unit, take this privilege of proposing the vote of thanks. All of us stand on the shoulders of the giants. We rarely look back and see how they have contributed and acknowledged. So many of those who have lent their shoulders to this event, I would like to express my deep sense of gratitude to our Honorable Vice Chancellor, Professor Kameshwar Nath Singh, sir. Our guest speakers for today, Dr. Megha Sinha, Dr. Vivek Narayana, for sharing their valuable inputs. And at times, it's really difficult to speak in between the doctors, because you all have a wide plethora of expert advice. So, but then I would just like to thank you for sparing your time with us and giving us such an informative session. Thank you, ma'am, so much. Thank you, Dr. Vivek.
Thank you.
Dean of Student Welfare, Professor Atish Parasar, Finance Officer, Professor Brijesh Kumar, NSS Coordinator, Dr. Budhen Kumar Singh, a member of the NSS Committee, Dr. Narsingh, for moderating the session, Dr. Ravi Suryavanshi, Dr. Priya Ranjan. My heartfelt thanks to all the teaching and non-teaching fraternity. A special word of praise and thanks to all the volunteers from different departments who came to participate and make this event a successful show. I would like to place on record our anchor for today, Mr. Vishal Anand and Mr. Ujjwal, without whose help and sincere efforts, these programs would not have been possible. Thank you, everyone. Thank you so much.
Thank you.
Thank you, ma'am. Thank you.